Hi, I'm Dr. Gayathri, Physician Changampally Remedium. Today we are going to discuss an important and challenging condition in case of colorectal diseases, which is Carcinoma Rectum or CA Rectum. We have Dr. Vismaya with us. She is an Ayurvedic Surgeon from Changampally Remedium. Doctor, how can we differentiate the common benign rectal conditions which are often presented in the OPDs like hemorrhoids, fistula or polyps with the malignant conditions?
See, in malignancy, when we are doing digital examination, the consistency as such will be different than expected in a hemorrhoid or polyp conditions. The borders may also be ill differentiated. Okay. There may be profuse bleeding, and there will be painless. Okay. Most of the conditions will be painless. And in hemorrhoids or hemorrhoidal mass, the positions are usually in 3, 7 or 11 o'clock positions. In case of malignancy, we cannot expect or predict such a regular position in conditions.
Okay, doctor. So, doctor, what are the common investigative methods or the diagnostic method we adopt here in case of the confirmation?
Any cases, if we are suspecting a malignancy of rectum or colon, colonoscopy we should prefer, followed by biopsy. Okay. And in blood test, we can go for CEA, carcinoembryogenic antigen test. And if we are suspecting any metastasis in liver, then LFT will be a good choice. And in case of lungs metastasis, if it is suspected, a CT thorax will be advised.
Okay, doctor. So, doctor, what are the common clinical presentations or the symptoms in case of CA rectum? Also, in consideration with the case we are going to discuss now.
Okay, the case which we have recently dealt was a 55-year-old male who had the complaint of bleeding per rectum 2 years back. And he consulted nearby allopathic hospital, and it was diagnosed as adenocarcinoma in exact, and it was a well differentiated grade 1 condition. So he underwent surgery without any delay, followed by chemotherapy as well as radiation therapy. And while he was undergoing radiation therapy, he developed the complaint of diarrhea. That is, once every 15 or 20 minutes he has to pass stools. There was no any pain, but there was uncontrolled diarrhea.
Okay.
Then again he underwent all the investigation, and 6 to 7 months after the first surgery, it was confirmed that there was recurrence.
Okay.
And the recurrence was in the form of polyps. And he again underwent surgery, polypectomy was done. Then before starting his next set of chemo or radiation therapy, he approached us. Okay. And he is under our treatment for almost 6 to 7 months now. Now his bowel habits are like, when he came for admission, it was once every 30 minutes. He has to pass stools. The stools was normal consistency, even though quantity was less, but the patient was not able to even sleep at night. Then we undertook him and we did all the treatments following a specific protocol. Then till now the recurrence, there is no any recurrence, or the patient is satisfied.
So, as you have already mentioned, what were the treatment protocols or the exact Ayurvedic approach which was being done on the case and usually which is done?
Okay, two main important therapies which we have administered in the patient was Virejana, that is medicated purgation, as well as Kashayavasti or Niruhavasti, that is medicated Kashayas are used for enema. Along with that, oral medications in the form of tablets, as well as kashayas, as well as arishtas were given to the patient. And other panchakarma procedures included abhyanga, then nabi pichu, and matravasti, talapodichil, as well as shirodhara. And we approach the patient as a whole, not just concentrating on the anorectum as such, and the treatment was successful as such.
Okay. So, also, doctor, when we consider the case, was there any kind of complications that was noticed by you or something like that?
The complications was as such not there from the treatment point of view, but even though his bowels were number of times, the frequency of bowel movements were once in every 30 minutes at the time of admission, then within 2 weeks it became 5 to 6 times in a day. But again after Matra Basti, it again became once in every 1.5 hours. So like that observations were made, but at the time of discharge his bowels was 1 to 2 times per day, and he was not having any problem at night as such.
So that was a very good improvement.
Yes.
From
But
what
one thing we have to note here is that the case was a well differentiated grade 1 adenocarcinoma. So the prognosis in such case is good as such. So compared to an ill differentiated or grade 3 carcinomas.
Okay. So also doctor, is there any exact patya or a diet regimen that should be followed in such cases?
See, from our point of view, Ajirna as well as Mandagni, that is anything which affects the digestion of the patient as such, should be taken care very importantly. And for that we prefer that the patient should avoid any heavy diet, oily and spicy food, and untimely food.
Okay.
This was advised to the patient strictly.
Okay. So as the expected one, what was the expectation or the success rate or the usual outcomes that can be expected in case of rectal carcinoma or something like that?
See, the follow-up MRI showed that there was no any recurrence, and the CEA also showed that it is within normal limit and less compared to the previous CEA.
Okay. So I think the viewers would have they would have received a proper, deeper insight into the diagnosis and the Ayurvedic approach towards carcinoma of rectum or the CA cases, how we deal with it. So I hope this discussion was helpful. Thank you so much.